Oh, I want you guys to see this video. Katie Porter destroys Big Pharma CEO. I'm going to make a reaction vid to this shit. Watch this.
Is it time to defund Big Pharma?
You're the CEO of AbbVie, which makes the cancer drug Imbruvica. Do you know what the annual price of Imbruvica was for a patient taking the standard 3 pills per day in 2013?
$130,000. So what?
$30,000.
But today, for those same 3 pills.
Whatever I feel like. How about that?
$169,000.
We have 181, but we can agree that there was a significant increase.
Yeah,
AbbVie
so?
Didn't spend any money to create Imbruvica. It was invented by a smaller company, Pharma,
yeah, so?
which you later acquired, correct?
We paid $21 billion for the company, correct?
21 billion, stupid. 21 bill. You spend that like it's water, but it's a lot to us.
Expensive to acquire them. Mr. Gonzalez, do people need less of this medicine, Imbruvica, to treat lymphoma now?
No.
Yes and no. No, there's not fewer people with lymphoma, but there is serious competition for BTK inhibitors. So technically, Mrs. Congresswoman bitch, we need to make this money back. Quick.
No.
Now, you told us that you spent $2.54 billion for
Yeah, Karen, we did.
For Imbruvica, even though the drug didn't get any better.
The drug didn't get any better because the day the drug's invented is what it is forevermore. But you got to study the medicine in new indications to see if it works for more people. That costs a lot of money.
Really, it was all for these innovations and indications.
An indication is a new disease. So it's potentially treating a brand new kind of cancer. It's not one of these. It's people's lives. It could be you that's saved by this miracle drug. So when you do indications, that's called the disease. That's what an indication is for. It's what's indicated for by the FDA. That's what it means.
Which are designed to keep competitors off the market.
They're not designed to keep competitors off the market. They're designed to help more people and make more money, which is a good thing for both. Fucking Karen.
And find new sales opportunities. So I want to look at what other money AbbVie spends doing its business.
Whatever we feel like. How about that? This is America. I can do what I want with my company.
You filed 165 patents for Imbruvica.
So what? I'll file 166 on your ass. Yeah. You got nothing to say. Real shit. You pay $21 billion for a company, you gotta get your money back. You think this is a game? It's not a game. It's a fucking game.
Is it time to defund Big Pharma?
First of all, who are you? Who is that guy? That sounded like an NPC. Who was that? Is that you, Nibbles? Is it time to defund Big Pharma? Big Pharma and every other business funds itself. There's no person funding it like you could just defund it. It's a company. What are you going to defund my lemonade stand? What stupid shit is that? My cat knows better than that. Right, Nibbles?
Do you know what the annual price of Imbruvica was for a patient taking the standard?
If I were him, I'd say, I don't know. Just Lil Wayne it. I don't know. How about you stop asking what price the drug is and ask the fact that that person's alive now because of the drug? That's priceless.
Today, for those...
What was that? Look at that. Look at that fake melodrama.
Today.
Look at it. Today.
Dollars.
Now, you told us that you spent $2.54 billion for R&D.
That's a lot.
Okay. Even though the drug didn't get any better.
How does it get better? How is it supposed to get better? How does that work? Explain that to me, a woman who's never been in pharma a day in her life. How is it supposed to get better? The molecule shifts? It morphs into a new drug? The fuck are you smoking? Do you know anything about the business? The drug has to stay the same, man. It literally by law stays the same. It's the same molecule.
It was all for these innovations and indications.
These clinical trials that you do to try to save more people.
Which are designed to keep competitors off the market and find new sales opportunities. You filed 165 patents for Imbruvica.
Yeah, so the $21 billion don't go out the drain.
To keep competitors off the market. Mr. Gonzalez, how much did you spend,
You.
AbbVie spend on litigation and settlements from 2013 to 2018?
I don't have that number offhand. I won't be happy to give it to you.
Okay, $1.6 billion, $2.45 billion on R&D, $1.6 billion in litigation.
Wait, whoa. First of all, you're 100% wrong because you're looking at litigation and settlements over 6 years, right? What are you lying for? You fucking lying. I can pull that up in 2 seconds. That's why these sheets come in handy. That's over 6 years. Fucking lying. Look at this misleading bullshit. R&D for 1 year. 1 year of R&D is $6 billion. 1 year, 6.5. Settlements and litigation, 1.6 over.
Just $2.45 billion on R&D, $1.6 billion in litigation and settlements
From 2013 to 18. 13, 14, 15, 16, 17, 18. That's 6 years. And it's 1.8, so that's 300 a year.
I don't have that number offhand. I won't be happy to give it to you.
Okay, $1.6 billion,
1.6 over 6 years is 267, right? 267 million. And R&D last year for AbbVie was 6.5. So she wants to make a pie chart. I can make a pie chart too, bitch. Watch and learn. Which number's bigger? Shit, you confused. Look at my chart. My chart's the truth. You trying to make them shits look the same. The fuck is wrong with you?
$4.5 billion on R&D, $1.6 billion in litigation.
Can you imagine being like the grunt that works for this bitch? That is like cutting out the cardboard? Like, we're gonna trick them with this construction paper. I went to kindergarten, I can do this, and let's make it look similar.
Try 334 on for size.
Tried that on for
How much did
size.
AbbVie spend on stock buybacks and shareholders, stock buybacks and dividends?
However much it
Your
wants.
shareholders from
However much I want.
2018.
Well, stock buybacks, if you actually look at just pure stock buybacks, it would be about
$13 billion.
$13
Stock buybacks and dividends is the question, sir.
dividends, and they have to come back with a number for that over that period of time.
$50 billion.
Yeah, so what?
When you tell us that R&D justifies those price increases, the big pharma fairy tale is one of groundbreaking R&D that justifies astronomical prices. But the pharma reality is that you spend most of your company's money making money for yourself.
Yeah, that's what a company is. That's exactly what a fucking company is. Wake up and smell the coffee.
And your shareholders.
Making money for yourself and shareholders. What you want me to do, lose money for myself and my shareholders? Fucking bozo. Like that was... Who's impressed by shit like that? I don't know, man. I'm heated. I'm pissed. You know, I have a friend who reached out to me. They have a 3-year-old girl, right? 3-year-old girl who has a very rare form of leukemia that is not treated by any other medicine. Okay? You with me, camera guy? You with me, Anam? Guess what drug they're trying on her that is starting to work? This poor little girl is going to die. But there's a drug called Venclexta by guess who? AbbVie. That's right. AbbVie, the same company that makes Humira, the same company that makes Imbruvica. They also make Venclexta. That's right, Anon. And Venclexta might just save this little girl's life. She's 3 years old. Big thing on Twitter about it. So if this woman had her way, there'd be no Venclexta for the 3-year-old girl. It would just be, sorry, if there was only a company that had the incentive to save your life and they would get paid, we'd have a solution. Thank God, you know, most people aren't fooled by this shit.